I'm doing something really different and special today. My girlfriend Deb is here. Although she's been absorbing a bunch of information from me in various pockets of the world, we've never done a formal consult. So she totally volunteered, not my idea, to come on the podcast and do a consult totally cold. I'm Dr. Kate D, founder and medical director of MedSpa, and this is MedSpa Confidential, where we expose the risks, the red flags, and the outright illegal practices happening inside med spas right now, because you deserve to know what's actually going into your body before you say yes. So what you're going to see is completely unrehearsed, but I'm just going to kind of do a consult the way I typically do. And so maybe a little extra funny because it's Deb, but we'll see. So anyway, Deb, thanks so much for doing this with me. Okay. So I'm just going to launch into what I would normally start with, and she'll ask questions as is naturally happens. So what I like to do in these consultations is just start with the basic things that are happening to your skin as you get older. So you kind of understand the foundations and the reasons why I recommend what I do. And then we kind of get into specific problems after that. So we'll start with basic prevention that really applies to everyone. The way I use the age 30 as sort of a proxy for when you really need to start doing stuff to prevent these changes. But anyway, so Deb is 51 years old, and you have no makeup on right now?
None.
Okay. So
a little bit of sunscreen, that's all.
Right, which is good. So let's just start with the basic things that are happening to your skin. So there are three big things. So there are a ton of things that are happening as you get older, but there are three really big dominant things. So the first one starts in your 20s, and that is that your epidermis slows down in its turnover. So when you're a kid, it's about 4 to 6 weeks for a new little baby keratinocyte to be born and work its way up to the surface of your skin and slough off. So the epidermis is the top layer where those cells slough off every day. And as you get older, that slows down starting in your 20s, and it just gets slower and slower and slower as you get older. So what that means is you get this buildup of dead cells that just sit there, and those cells are more dull, they're more leathery, they tend to retain all the little wrinkles and pigment they picked up along the way, and they also block the absorption of anything good you want to put on your skin. Mm-hmm. So a lot of people know they're supposed to exfoliate, right? But that's why, really, is so that you have nice, fresh, young, happy cells at the surface. And those are brighter, they're less spotty, and then also you absorb those stuff. So that's the first thing. And the easiest thing to do for that is like a daily exfoliating cleanser. You don't need to do anything special. You don't need a facial. You don't need an exfoliating treatment like dermaplaning, although those are fun and they do stuff. You don't really need that. So, okay. So the second big thing is the dermis, the layer underneath the epidermis, right? That is a thicker layer that has all the collagen and elastin and some other stuff in there that we'll talk about. But that layer keeps your skin thick and springy, okay? So by the time you're 30, the cells in that layer that make collagen and elastin, those go dormant and they don't make anymore. And your body breaks those things down naturally 1 to 2% per year. So, but after around 30, you're not replacing it anymore. So your dermis slowly thins out. And as it does that, it's no longer thick and springy. So it starts to retain the wrinkles and starts to, as it thins out, starts to droop. So you get a little droopy, hangy skin as you get older. And so super important to go in there and make those fibroblasts wake up and make collagen for you. So that, unfortunately, topicals are great. They will stimulate those cells to make collagen, but only if they're awake. So that means either microneedling or laser or, for the people in their 30s and 40s, 3 times a year, because generally every time you do it, those fibroblasts respond with about 4 to 6 months of activity, and then they go back to being dormant, which is why we say every 4 months you do it again, right? So, and then there are bigger guns for people closer to our age that where you actually can thicken and tighten the skin, but we'll get to. So fibroblasts, keep them awake. So that's number 2. And then the third thing is that underneath your skin, everything under there is changing as you get older. So your bones are remodeling your whole life. So it's super important to get your calcium and vitamin D, no matter how old you are. But really what's happening is your skin is on a scaffolding, and that scaffolding is not static. It's changing your whole life. So one of the first things that happens is it starts in your 30s, or the little fat pads around your face. You know, when you're a kid, you have all this baby fat and keeps your face kind of round or oval, right? So we lose those pockets of fat as we get older. And the first one to go is usually the one under your eye, okay? Yes. We both have this going on. So thank goodness for reading glasses. But you know, the under eye area is a little bit of a double whammy situation because it's the first place that we lose that fat pad. Okay. So you get this volume loss. And as you lose volume, the skin isn't held up as much. And so it's a little, less supported. And then it's the thinnest skin in your body. And so as that dermis thins out, then your first place that you notice that collagen loss is in the under eye area. And so that thin skin gets even thinner. And so between losing a little volume and then losing the thickness of your skin there, that's usually the first place that anyone notices that anything's changing. So a lot of times I see people in their late 30s or early 40s where they're like, especially when they've had a kid, they're like, that kid's killing me. Because my under eye, what's going on there? And it's really just that all these things are happening, and it's just the first place that you notice it. So where volume loss is a problem, that's where fillers and Sculptra, which is this injectable that stimulates collagen kind of in and under the skin, where it replaces volume when it's lost. That is where filler fits in. And so not everybody needs that. And I think out there in the med spa world, filler's very much overused, where you take someone like us in their 50s, we've got some loose hanging skin. But if you haven't lost volume, then what they're doing out there is pumping up the face filled with filler so the skin is taut, but they're not putting it in places where the person has lost volume before. So now they look weird. They have a weird pillow face, or like, what's going on? And where you see the kind of famous people where their face doesn't look right and you think, what's going on? It's because they're pumping fillers in places where they didn't lose volume. And now they look different. They look like a whole different person. And we're very conservative with filler at my place. I think most people, at least in the Pacific Northwest where we live, people appreciate that.
We want to look normal.
Yeah.
Sorry.
Just want to look normal.
To anyone
right.
Extra big, anything.
So, but those are the 3 big things. Okay. And my 2 recommendations for kind of everybody walking in the door are a really good skincare regimen at home where you're giving your skin, you're exfoliating the dead cells, you're giving your skin all the vitamins and antioxidants it needs to make collagen and protect itself from the sun. You're using at least one serum that stimulates collagen so that when you do the laser, the microneedling, whatever, those cells, that increases your yield. A really good moisturizer for your barrier and a sunblock in the morning, and ideally a retinol at night. For most people, they can tolerate that unless they've got bad rosacea or redness. So really good regimen, and then something to keep those fibroblasts awake and working for you. So those are my 2 main recommendations for kind of everybody over 30. And then we generally talk about like what's bugging you. So tell me, besides like how to keep your skin, like what are the things that really bother you? What are the things you want to work on? There's no reliable way to know if a med spa is following safety standards or cutting corners until now. The MedSpa board certifies clinics that prove they're doing things right, verified products, licensed staff, and actual medical oversight. It's the difference between rolling the dice with your skin and knowing exactly who's holding the needle. If you're looking for aesthetic treatments, go to medspaboard.com to find a certified spa near you. And if you already have a med spa you love and they're not certified yet, please send them our link. Med spa owners getting certified does more than build patient trust. It should also save you a ton on your malpractice insurance. Do the right thing and go to medspaboard.com. Keep listening, keep asking questions, and stay safe out there.
I would say, 51, perimenopause, keeping everything hydrated is a thing. So your first recommendation is great. Dark circles for me are one thing. And then also some age spots. I know I have like at least one here. And I also think this is when I accidentally poked myself with a cactus plant. I could you not, but I had this little red dot that like hasn't gone away. Maybe you can see it. Maybe
Yeah. It's a little red dot because that happens a lot. Those are actually amazingly easy to treat. So in my place and a lot of places have a little low-level cautery device, and a lot of people have little dots like that, or that one's not a cherry angioma, but a lot of people have those little cherry angiomas. I'm sure you have them elsewhere where it's like a little round red thing, right? Just so you all know, those are so easy to zap and get rid of. I've had so many patients where they're like, wait a minute, that's been there for 8 years and I hate it. It's like on the tip of my nose, I can't stand it. Well, actually, those are really easy to treat. Sometimes you need to zap them more than once, but those are really easy to make go away. Even just like zap, zap, and it's like gone forever. So that's a super easy one. As far as age spots or sunspots or sun lentigos is what they're called, those are actually pretty easy to treat too. So there are a lot of different things that address those. So one, there are over-the-counter like topicals that we use as part of a regimen, where actually I have one that I use every day because I have a lot of sun damage from, I'm 58 and we didn't really have sunblock growing. Did you have sunblock?
I feel like it came around in high school.
Later, right? And I was probably in college or med school.
Yeah.
So when we were kids, people were out there with the sunbathing, with the metallic things like, baby oil, right? Like, so I mean, my arms, I don't know if you can tell, I have a lot of sun damage on my arms. My face would look like that if I didn't use these serums and a lot of sunblock every day. So the serums that treat pigment work pretty well. You have to use them every day and it takes months. But it will, because what happens is some of them help pigment slough off, but most of them, what they're doing is preventing new pigment from forming. So if you allow the pigment that's there to slough off over time or help it with some exfoliating things and some other stuff, and suppress your melanocytes from replacing it, then over time you can actually get rid of those. But there are many different procedures that we do that also help just get rid of pigment. And one of them that would be great for you would be, we have a non-ablative laser resurfacing that does stimulate collagen. So that's one of the things I mentioned earlier, where 3 times a year, stimulate your collagen. Well, the non-ablative laser resurfacing is very safe, very little downtime, and that lifts pigment. And we're going to get into that in a second. I'm going to pull up a diagram that will show you that. But then there are also other treatments like peels and BBL or IPL that treat pigment that really help accelerate that. And anytime you're doing a treatment where you're getting rid of pigment, you also want to use one of those, because what's happening with that is you're getting rid of the pigment one way or another. But you also want to suppress your melanocytes from just replacing it. Because if you do a procedure, any of these procedures, a lot of people out there are really into BBL, a lot of people out there are into laser and stuff. Get rid of the pigment, right? Those melanocytes are already revved up and making that pigment in that spot or in whatever spot you're working on. And so you want to suppress its replacement. Otherwise, it'll just come right back. So the next time you go to Hawaii, you're into Hawaii, right?
I love Hawaii.
She loves Hawaii. Yes. Okay, so the next time you go, if you don't use religious about your sunblock and then use these serums to suppress your melanocytes, you're just going to come back from Hawaii with that right back, right? So that's really important. And then the other thing was under eye. Okay, under eye stuff. Now, that's a big deal. So back in the day, when I started all this, going on 13 years now, people were doing a lot of filler for tear troughs. The tear trough is the under eye area. Fraught with problems, okay? So I should probably do a whole little solo episode about why I don't like that. But So we moved over to using PRP or PRFM in that area. So no risk of vascular occlusion, or essentially no risk, very safe, and longer lasting results. It does require more treatments. So, it requires a blood draw. Downside, requires a blood draw. I hate having my blood drawn. You don't care. Okay. So if you don't mind having your blood drawn, it's not a bad procedure. So, but that involves, spinning your blood down, taking off basically the serum and the growth factors and putting it here. And we generally use PRFM, which is activated PRP, so that it kind of forms a gel once you inject it. And that acts like a depot for the growth factors, and it helps stimulate collagen in that area. And then that builds up over a few months, and then you do a few treatments. Usually we do 3 treatments, and then you've got your own collagen there, and that is long lasting. So with filler, you put it in, and then your body starts breaking it down day 1, and usually within a year it's gone. And so with PRP making collagen, you do that and you build collagen over many months, but then your collagen lasts a long time, and your body breaks that down 1% to 2% per year. So that's not too bad, right? You're building it over time, and then you're losing it, a small percentage at a time. With filler, it's just gone in a year. So a lot of places like to do that, because guess what? You have to come back and have it again and have it again. And it's kind of dangerous. Like, there are a lot of issues putting filler in tear troughs. Besides vascular occlusion, you can have, if you put it too close to the surface of the skin, it can end up with this bluish tint that is called the Tyndall effect, but it's the way the light hits the filler. Not cute. So we don't want that. And then also people have trouble getting it in the right plane. And there are many, many cases where they did this one MRI study where they showed filler in all the wrong places, and it actually lasted a really long time. Sometimes they even got it into where the eyeball is. Okay. Not a good thing. So not into that. But anyway, so that is a really good option. And the other thing is doing that laser here. We can actually get very, very close. We can't do your eyelid, right? But we can get very close and like pull your skin down and do that whole area. You really want to get that skin to be revitalized and build collagen, so it stays thicker. So those are important. There's a whole kind of debated thing where this new product, there's a purified PDGF that I'm not doing, by the way, but it's very, very controversial right now. A lot of people believe that's the way of the future. What in your PRP, so in your blood, one of the main growth factors we're getting and using is platelet-derived growth factor. Well, they purified that, and it's just not FDA approved for that purpose, or in the form that it's actually purchasable right now. So it's kind of complicated, because what you can purchase is a component of an FDA approved drug, but it's not FDA approved in and of itself. And it comes in a vial that says, not for injection. So like, it's like we're waiting for the company that makes it to do that. But anyway, it wouldn't involve a blood draw, and you could just inject it and it'd be way more powerful than PRP. So that might be down the line. But for now, you could do PRP. I like to wait till the FDA approves it. I know, me too. You. Yeah, yeah. And because nobody's really studied it, when you just inject pure stuff into what happens, we don't really know. But people are out there using it all across the country. So there's probably a lot of anecdotal stories. But for now, that's not a thing that's commercially available. So, but anyway, so that's under eye stuff. So I'm gonna show everybody. We're gonna share the screen here. And we're going to look at a diagram. All right. So we're going to show this diagram so everybody can see it. So we're going to look at the difference between all these different treatments, because people get really confused. Like, well, what's good for me and what's good for my daughter who's, 30. Okay. So the first thing is microneedling. And microneedling, what that is that's a pen that has multiple needles that go in and out of the dermis to about that depth. Okay. And what happens is we use some kind of growth factor serum or exosomes that penetrates down through those channels and hits the little fibroblasts and says, hey, make some collagen. And that's what microneedling does. Okay. It doesn't do much else. Okay. People often sell microneedling as though it did all kinds of other things. It really doesn't. It's not powerful enough to do much else, but it does stimulate collagen. And it's definitely at least enough to keep those fibroblasts awake and make collagen for you so that when you use a collagen stimulating serum or a retinol or vitamin C, it actually increases your yield from microneedling. So this is what we say, at minimum, do that starting around age 30, about 3 times a year. So then the next thing is LaserMD Ultra, which is a non-ablative laser. And normally, if I'm doing this in person, I'm drawing this all out. But anyway, I did this for this purpose here so that you could see what I would be drawing. But this is a 1920 thulium laser that it's non-ablative, meaning ablative lasers vaporize the tissue, okay? Lasers can be quite strong. I mean, certain lasers you can shoot down, missiles out of the sky, right?
Right.
So, okay. But what this does is zaps the epidermis and it goes a tiny bit into the dermis like that, okay? And it zaps that tissue in a fractional way, meaning it zaps this little column of tissue but leaves this little column untouched. So there's several things happen. This column of tissue that it zaps gets damaged just enough for the skin to spit that bit out over the next 5 to 7 days or so. Okay. So at any given time, we are zapping somewhere between 20 and 40% of the skin surface area. So you're getting rid of, let's just say, a third of your skin surface area each time you do one of these treatments. These little bits, I've tried to draw pigment in the epidermis. Most of the pigment, that sun damage that you have in your temple, that's in your epidermis. Okay. So any little bits that you've zapped, the pigment goes with it. So you're decreasing pigment, around a third of it, say, right? A random third, but a third. And it's the full thickness of the epidermis that you're getting rid of. So you're resurfacing and you're also getting rid of pigment. And the other thing it's doing is it's sending heat waves, enough heat energy into the dermis that it's actually turning those fibroblasts on. So you get some collagen from your fibroblasts. And that way, again, if you're using a collagen stimulating serum, you increase the yield. So the laser does a few things, not just collagen, but resurfacing and get rid of pigment.
Okay.
So the next thing that on the screen here is the Genius RF microneedling. And that's a thing I probably do recommend for you. I've had many of these myself. What that is these are also needles that go into the dermis, but they are insulated. And so they just deliver a blast of RF energy inside the dermis. Okay. And we do several passes where different depths. So you're actually causing this coagulation throughout the dermis, and that stimulates a ton of collagen, a ton of elastin. You can imagine that's like orders of magnitude stronger than just heating them up a bit. And the key thing is that we're not hurting the epidermis at all. We're going through it, but we're not doing any damage to it. And we're also not going deep to where the fat is. Okay. So we're not harming fat. We're not harming the epidermis, but we're causing a lot of increased collagen and elastin. So that actually can thicken and tighten the skin. And when we do this treatment, we often will do this right afterwards, the laser on top of it. So because most people who want that skin tightening also want resurfacing. And of course, so do I. So I've had many of these treatments. The year I turned 50, I did 5 of them. We generally recommend around 1 per decade of life. So I would recommend 5 of those in a series, and there's no hurry to do them. We generally recommend between 1 to 2 months, but you can go up to 3 to 4 months and you just keep building on it. So I would do, a series of 5 of those. And then ever since that, I've done one every 6 months to maintain it.
Okay.
So I don't know, probably my skin looks good because of that. I just had a person much younger than me estimate my age at 46 and I'm 58. So I took that as a big compliment. But anyway, that's what that does. Okay. And then just to cover a couple of the other things that we do, BBL is very popular. That's a trade name for an IPL. That is stands for broadband light. And what that's good for is pigment, so brown things, and redness, red things. So focal red things, broad spread redness, it could zap that easily. And so what happens with that is the top third of pigment sloughs off. It hits the pigment, it gets darker right away, and then takes about a week or two to slough off. So like the laser, you're getting rid of about a third of the pigment, but it's a different third because with BBL, you're getting the surface third. And here you're getting full thickness, but a random third of that. Okay. And then the other thing that the BBL does is sends light energy into the dermis, and you've got vessels under there, and it zaps those vessels and causes them to shrink. So it's very good at doing brown and red things. Unfortunately, it's just not enough heat or power to go in and really cause much collagen stimulation. Now, that same company sells a filter that claims to do skin tightening. In my opinion, it's just not strong enough to actually do much. I don't really sell this or do this for that purpose. You could maybe get a tiny bit of collagen out of it, but I wouldn't. It's just not strong enough for that. So unfortunately, there's no way to avoid doing something else for collagen. And then the last thing on this slide, and then I'll stop sharing the screen, is M-Face. And there are a couple other machines that do something similar, but what M-Face does, relates the muscles that, there's a pad that sticks to your skin, and it does muscle stimulation. And it also heats the skin. And so it's able to strengthen those muscles, lift the muscles. The cheek applicators, they showed that overall cheek volume increased by almost 1.5 cc's. So that is like 1.5 syringes of filler equivalent. So as measured by some computer analysis. But there's an under eye treatment and under chin treatment and forehead as well. But I think I don't care that much about the forehead one because we're so busy relaxing the forehead for most people. And we'll get into Botox in a second. But it does those two things. So it does lift. It's pretty kind of cool, especially if you have an occasion to go to, like a wedding or a photo shoot or something. It also stimulates collagen and elastin. The limitations of something like M-Face is that it only stimulates collagen in the areas where the applicators are sitting on your skin. So it doesn't do everything, which is why I don't feel like it replaces the laser or the RF microneedling, because where the real critical areas around the eyes and around the mouth, that's where we really were like, please do something, right? Yeah. And unfortunately, M-Face doesn't have an under eye applicator, and that's kind of cool. But circumferentially around the mouth and circumferentially around the eyes, we would really like something that does all of that. So I don't feel like it replaces those things. Okay. So I'm going to get rid of our little diagram here. So those are the main things. So I think for you, we didn't talk about Sculptra all that much, but I think you're a fantastic candidate for Sculptra because you're generally thin. You've lost volume in your face. You've lost some collagen. So we're going to stick to the recommendation of that Genius and Lay's, like a series of 5. I think you would love that. But I also think that you'd be a great candidate for Sculptra. So Sculptra it's poly-L-lactic acid. It is a powder that gets dissolved in water, a lot of water, actually. And so when we inject that, you're kind of poofy afterwards. Like it's not real pretty afterwards. You're just kind of a little poofy. But then it deposits the Sculptra in all the areas you want collagen. And then your own collagen grows over the next few months. And that builds on itself as well, kind of like PRSM and the tear troughs. And it does kind of lift. We do cheeks, we do the nasolabial folds down here. And so you can fill out that volume, and it lifts and fills out that volume.
Gets rid of my droopy little jowls.
It will help with both the Genius and Sculptra would help with that. I don't really like Sculptra for people with a very full face. They might have droopy skin, but their face is full. I don't like it for that. It doesn't make people look fat or anything, but it definitely is really great for people who are thin and have lost volume. So those two things might be helpful. And then The other thing that I'm just going to be frank, we've already done this, okay, is some Botox or Dysport. Those are my two favorite neurotoxins, although there are plenty of other neurotoxins that are great. That would point out here.
Just kidding.
No big deal. So what does Botox do? So Botox paralyzes the muscles that make certain lines. So we only use Botox for certain areas where it's safe and it doesn't make you look funny. So the areas that we generally do, number one area is the glabella. Can you make a mean face right now? Really? She can't even do it. Okay.
No, this is great.
Isn't that great? So the mean, I can do it though. Mine's kind of wearing off. When I started doing this, I was in my mid 40s. I had very, very deep glabellar lines. The only message that those lines convey to people is anger or concern. It doesn't convey like anything happy or kind. And so getting rid of those is kind of a no-brainer unless you're an actor, in which case you want to keep that, right, for your profession. The other big place we put it are forehead and also crow's feet. Those are all easy to do. There are some pitfalls. You want to go to someone who knows what they're doing. Forehead is quite fraught. You want it to be even and you don't want to drop someone's eyebrow or eyelid. And so that can be a very delicate situation. Crow's feet are really great to do. Pretty easy, except for there's a lot of little vessels in there. So you want to be really careful. In my practice, we have a AccuVein that shows where your blood vessels are. So we try not to hit those. It's not foolproof, but our rate of bruising is a little lower than most places. There are a few other places you can put Botox. So if you have our RBF, this is a clean podcast. So I don't know, we use the B, this. If your corners of your mouth naturally turn down, there's a little sliver of a muscle that pulls that down. You can actually put a tiny amount right there in that muscle and then even out the corners of your mouth. I don't really have that, so we don't have to worry about that. And then a couple other places it's really easy. Bunny lines, those you don't really have. Well, you can make them, but but those aren't real prominent on you. But we can get rid of those. Some people it's very, very prominent. And then another great use is for masseters, for people who grind their teeth. We do that very, very often. And it's really great to help with TMJ, teeth grinding, and migraines. The other thing that's really easy are platysmal bands. Those guys, some people are very prominent. Dimple chin, also a little bit hard. So anything in the lower face really takes experience. You do not want to go to someone who does not know what they're doing. You will end up with an asymmetric smile or something really off. It's not impossible to happen when someone has a lot of experience, but those things are much more likely if the person's pretty new. So that's what Botox does. And let's see, was there anything else we talked about or you'd like to ask questions about that we haven't covered?
I mean, I know for me as just a consumer, before I met you, I had done Botox a couple of times, and that's how I discovered that it helped me with my migraines. But it was originally developed for that, right? Can somebody get migraine relief at a MedSpa?
Yes and no. Yeah. So at a MedSpa, we do primarily cosmetic injections. But if you go to a headache clinic, they will do both the cosmetic stuff and the specific headache protocol, I think, is up to like 120 or 140 units. But they go in the back of your head and your neck and your shoulders. And we don't specialize in that. I don't know of a med spa that does. One of my PAs used to work at a headache clinic and she actually could do that whole protocol, but we tend not to because that should be covered by insurance. And so you kind of have to go to a headache clinic if you want your insurance to cover that. But we've had tons of patients who we've done just their face and masseters often, and their migraines have gone away. So it kind of depends on the migraine and where it's starting. But a lot of times they do start in your face and we can cut that out. So the answer, yes and no, like it can be like, but on the other hand, if you could get your insurance to cover it, totally go to a headache clinic because oftentimes it is covered. And I don't know a med spa that takes insurance. That's unusual. So any other questions?
And I think one other thing that I thought was interesting and also awesome is that you also do weight loss support and stuff. And it's not something I'm interested in doing necessarily. I thought that was kind of interesting.
And hormones too. It's interesting. So the whole med spa world has morphed into more of a wellness world. And it's not just about aesthetics, but about well-being, health, health coaching, hormones, and weight loss. And so we do we do have a weight loss program, and also we do manage people's hormones. I think that it is very important to go to someone who knows what they're doing with that, so that those areas, like weight loss, yes, for me, hormones, no, but like I have another doctor in my clinic who does that, who's got certified in menopause treatment. That is really specific, that you really need to know how to manage stuff. And one of the things in med spas in general is they get started with, someone who learns how to inject Botox, and then they learn how to inject filler, and they just have a very limited knowledge base. And one of the things that's been very important to me is to never ever offer something where I don't know what the heck I'm doing. So in my place, we have 3 doctors. We have 3 nurse practitioners now, 1 PA, all of whom are really well trained. And so just make sure if you are going to go to someone for those things. I know there's a lot of online weight loss programs now, and actually hormones too.
Yep.
They don't talk to you about much. I mean, I've had a couple friends who've done that where they know what they want and they just kind of go. They know they're not going to be asked very many questions, but it's really important to be able to go back to your provider and say, hey, I had this. Was that related to hormones? Do I need to change my dose? Like, do I need to, get on or off something else? Like, it's not that simple. But yes, a ton of places are offering that now. And I do think it's great because I do think that that's a huge service for people. I mean, it's been, for the most part, neglected in traditional medicine. So it's great. We should be providing that, but just make sure that you know what you're doing when you do that. So normally I'm not going to go through the specific regimen. Mm-hmm. So normally I would go through your skincare regimen, which we've talked quite a bit about. And I've covered the basics of that. And for any individual, it would be, most people, I would recommend an exfoliating cleanser in the morning and a gentle cleanser in the evening. And then at least one serum that stimulates collagen. And for someone who's got pigment like you, a serum that suppresses pigment and gets rid of pigment. And then, really great moisturizer, sunblock, and retinols. And I will say I try to get people into a sunblock that they just love the feel of on their face. So they'll wear it every day. And at my place, we've got a place where you can try them all in your hand and just figure what fits with your complexion. I do like tinted sunblocks if you can tolerate, having a tint on you, but that does block visible light in addition to UV, A and B. And that's really important for anti-aging and for a lot of things. So that's really helpful too. And there's a new sunblock component that was just approved by the FDA that I just wrote a blog post about. It's not out yet, but maybe by the time this podcast is out, that'll be on the website. But it's been used in Europe for years and years and years. And it's really great. And it's going to be available later this year in the US. So that's exciting too.
Cool. Yeah. I have one more question.
Yeah.
What about liquid collagen or, oral supplements for collagen? Should I be doing that to try to help? Yeah. Does it or?
Yeah. And so, it's not bad for you, but when you eat protein, your body breaks it down into short chain peptides and individual amino acids, and then you absorb it through your gut. And so collagen is just, eating it is just kind of a little more expensive way to consume protein. Yeah. So actually for your cells to make collagen, so what's going to happen is you'll absorb it and then your cells have to make collagen all over again. It's not like you can eat it and then have it go to your joints or your skin. So, so actually your cells really need vitamin C in order to make collagen. So if you're going to eat something that helps you stimulate collagen, it's actually going to be vitamin C rather than eating collagen. Now, those collagen powders are great. And what the thing I really like about them is that they don't have any taste or smell.
Yeah, they're so good.
And so you can mix them with your coffee and it doesn't mess up your coffee. You can put them in things and it doesn't change the flavor. So huge advantage there. And so if you can find a reliable source that's not too expensive, then it's not crazy. But it's not really, I know there's a bunch of studies saying that maybe it helps people's joints, but then there's just as many studies showing that it doesn't really do that. And so it just physiologically, it's not really going to be more beneficial than eating protein in any other form.
Okay. Well, that's good to know.
So normally walk her out to the front desk and give her all the information. So for people with all different stuff like rosacea, sunspots, melasma, other things that does not have, I would give them handouts about that. Acne is one of my favorite topics. So we're old people. We don't have that much acne anymore. Did you have acne as a kid?
No, not too bad.
Really. Yeah.
A pimple here or there.
So, but it's really great to have, all that information. Hopefully wherever you're going would be able to, and then hopefully give you enough information to either buy the skincare regimen or at least be able to find it online. And then, specific what to do for anti-aging and what to do for all the things. These things really do work. I was skeptical. A lot of my patients are skeptical that these things make a difference, but I think they really do. And even if in your 60s and you've done nothing, believe me, if you do that Genius and Lay's combination, I've had people where they're like, all right, I'll buy one package. We sell packages of 3. Right. So I'll buy one package this year, one package next year. I'll get that all done over 2 years. Makes a huge difference. It's kind of amazing. I've had people where they're like, I went home and I haven't seen my old friends in forever. And they're like, what are you doing now? It's like, it really does impact. And, as someone I'm 58 and I've said a million times, I have no filler in my face. I just take care of my skin and it looks okay for 58. So I'm hanging in there. So, and that's what we try to do for our patients. Again, we're in the Pacific Northwest. We like to look, natural here. So yeah, so that's my basic consult. It was kind of, and it's 45 minutes exactly.
It's perfect.
What we normally do it in. So hopefully this has been helpful.
It has been.
Thank
and
you.
I love the
For you
products
guys.
that you've introduced me to as well. And and thank you for helping me with my migraines and my Botox.
Of course. And now
I've got a whole regimen planned.
Right. So now you're ready for one more serum. All right. Well, hopefully this has been helpful for you guys as well. And check out the show notes. Maybe I'll put a link to this little diagram in the show notes and that blog post I mentioned. So until next time, I'm Dr. Kate D. Thanks for listening. If this episode opened your eyes to something you didn't know before, share it with someone who needs to hear it. Subscribe so you don't miss the next one. And drop a comment telling me your biggest takeaway. I actually read them all. Join me on this mission to keep you safe and push this industry to do better.